Welcome to the Burnout to Lit Up podcast. I am your host, Erica Del Pozo, occupational therapist, certified health coach, CEO and founder of Joy Energy Time, Miami Girl, and Pineapple Lover. In this podcast, we provide the resources on how to deal with stress, burnout, and anxiety, how to get energized, find true satisfaction and alignment in your life, and more. You will learn how to slay your burnout beast and go from burnt out to a lit up life. Let's do this. Today on the podcast, we have a very special guest. Anna Rodriguez has been a registered nurse for 10 years. She has 2 nursing certifications, Progressive Care Certified Nurse and Critical Care Certified Nurse. Anna is currently working as a critical care float pool nurse, but has experience working with open heart surgery patients and as a travel nurse. She has worked as a nurse manager for 2 years. She just returned from Boston after attending a nursing conference and participating as a social media influencer for the event. Her future plans are to get a master's degree and become a nurse educator. So without further ado, I welcome Anna to the show.
Thank you, Erica. I'm so excited to be here. This is a dream, to be a guest on a podcast. I think it's awesome.
Yeah, like I was telling you, it's a dream to do this, what we're doing, like to have a podcast, to be a guest, and to do all the cool things that we're both doing. Mm-hmm. Like, did you, when you started, when you entered nursing, did you ever think that there'd be something else like this?
Oh, yeah, heavens no. I mean, it's so interesting to, look back and see how it's all progressed. And I don't know, just, how many opportunities have come because of just the choice of what career I decided to choose. I'm super glad I did because it's been such a good fit for me, but I'm loving all these other ways to express yourself as a nurse and to connect with others. It's awesome.
Yeah, it's the same for me. You go into healthcare and you have that one goal in mind, but then you see for you and for me, and for so many others, all these opportunities, and it's so cool. Especially I think with social media, which we'll get into, but and your website and all that fun stuff. So yeah, why don't you start with introducing yourself and where you're from and how you got to where you are today?
Thank you. I would love to. My name is Anna Rodriguez, and I am currently living in Washington State. I'm working as a critical care float pool nurse, like you had mentioned. And I haven't been here always. I started nursing when I was in Idaho. That's where I grew up. I did about the first 7 years of my nursing career in Idaho in a few different areas, med-surg and telemetry. And the bulk of my nursing has been in the cardiovascular ICU setting, where we would do a lot of open heart surgery patients and people who are getting bypasses and valve replacements and just a lot of cardiac specific patients, which is definitely my favorite organ of the body. And then I ended up being a nurse manager for 2 years. At that point, when I was ready to transition out of that role, I went and did travel nursing and did a couple jobs in Oregon and Washington. And then now I've been here in Washington almost a year in a permanent job. And then I think the next plan is to head down to Salt Lake. We're just working out the details of when and where and what that'll look like, but that'll be the next adventure. So
that's so cool. And I haven't told this to you yet, or really to anyone, but my husband is a physical therapist, right?
Yes.
So we're going to do travel therapy too.
Oh my gosh, I'm so excited for you guys because, first of all, you're going to love it. The fact you can do it together is freaking awesome. There's so many travel couples that I know who will go do different assignments together, and it's such a great place to have a career, and no job I know of besides being in the healthcare setting can do something like that. I'm excited for you. Do you know where you're going to go? What do you want to do?
We want to start in California and do the whole West. And I think I reached out to you about we're going to be stopping in Seattle, and then you told me, Yeah, so we're going to road trip it from Florida to Pennsylvania first to see Mike's family, and then from Pennsylvania all the way to California. And we're going to drive through Montana and like all the northern states. So we're really jazzed, really excited.
Have you ever been over this direction, like that far west?
Yeah, I've been to Seattle twice because I have a friend there, and it's just the complete opposite of Miami in like every sense of like culture, like scenery. Like in Seattle, things are really fresh and green. And everyone's so environmentally conscious. Yeah, it's just like I love the East, but I love the West, and that's why we really want to do the West. We're just really like ready, and we're ready to get out of here. Like not in a bad way, but we're ready to like do the travel thing. Like if you know, like you understand, like your heart was in travel, and it's just so fun.
Right. Yeah, there's so many experiences you can have, and like you and Mike are at a great place in your life where you can do it, and like why not? It's going to be awesome.
Yay. So I want to ask you with that, what has been your favorite role as a nurse? I know you talked about being a manager and then travel nurse and all these different settings. So what has been your favorite role so far?
It's a really good question. I do a lot of self-reflection, and ultimately, so I'm sure this answer would change at different points in my career. But at this moment in time, I truly enjoy being at the bedside the most. Those 2 years as a nurse manager were very eye-opening. Like there's so many parts of it I enjoyed. I really liked being able to help the nursing staff and be in a leadership role where I could be part of the group that makes a difference and makes change occur. But there was a lot of hard parts about that role too, where, you're kind of the one that needs to fix the problems, and the discipline aspect was not my favorite. And just having to balance all that was hard. And then it was long hours. And I have a personality type where I would really struggle to separate work and life, and leave work at work, and I'd think about things when I get home, and I'd stress about conversations I'd have to have the next day, and it was just really wearing on me, and my husband could tell. And so after a while I decided I need to get back to the bedside. I want to be with patients. That's where I'm most happy, because it's just the observation I made at the time. But then now, as I'm back at the bedside and having gone through that experience, I do recognize that I get that same happiness and fulfillment when I'm in a preceptor role, or when I'm on social media connecting with other nurses and finding opportunities to answer questions and coach them through things. And so that's why I'm really excited about pursuing a nurse educator role, because I think that'll just really be a good spot for me to kind of meet all the best of all the worlds that I've encountered so far. Kind of all the good parts in one spot.
I hear you. I definitely hear you. And that leads me perfectly to my next question about how, like, your burnout story, because I know talking with you in the past that role as a nurse manager was one of where you experienced burnout. So can you walk us through, like, when you started to notice that you were feeling burnt out? When was your rock bottom, and how you were able to get out of that?
Yeah, definitely. A lot of it is, it's still something I'm trying to figure out how many details I should divulge. It's not fully just my story, obviously. There were a lot of other factors involved, but ultimately, when I think about how to condense it down, I was in the nurse manager role, brand new, trying to figure that out. And about a year into it, we introduced a new therapy for patients. We started providing nurse-driven ECMO, which is extracorporeal membrane oxygenation. Essentially, it's heart-lung bypass. You're running the blood through a machine, and the nurse is managing that at the bedside. And it's a last-ditch effort, essentially, in trying to save a patient's life. It's used for when their lungs are failing or their heart's failing, and you're trying to treat them to fix those organs so they can get off that machine. And it works sometimes, and a lot of times it doesn't. And there's a high mortality rate associated and a lot of complications. And these patients are on these machines sometimes for a very long time. That's kind of ECMO boiled down in a nutshell. So they're the sickest of the sick you can see in the ICU just about. And so we started this program. We had started training the staff, and I won't get into all the details, but essentially just it really tested us as a group. It pushed us in a lot of different ways because we were seeing, patient situations we'd never seen before. We were working hours. These patients have to be monitored closely, and it's one nurse to one patient. Sometimes it's two nurses for that one patient if they're really sick. And so we would be managing staffing issues, trying to staff for these patients that we hadn't accounted for in our staffing ratios prior to this. Just all these different nuances as a manager that, that I'm trying to help manage, and then morale was really affected by it all, as you can imagine, because you're seeing, just this totally different, thing occurring. So it's just kind of a mixture of all of that started it. There were days and nights where, I'd be helping work the floor. I was a working manager, so I'd be working with patients and working the floor, and then I'd also have to do my manager role at the same time. And thankfully, it was a small 10-bed ICU, not too large of an area, but it was a lot. And I don't know. There are definitely things I would have done differently, and part of it is the support for the staff in dealing with these highly acute patients, in dealing with kind of the processing of the emotions of it. And then things I would do differently for myself and how I managed my time both in and out of work, and things I'm trying to do differently now. So that's kind of all the triggers. I'd say the rock bottom point is when I was sitting in a meeting and I had just worked that night because I was there to help cover the charge nurse who was sick. I had worked the previous day because I was there as the nurse manager. I think I had a nap in between. So I worked a day shift, had a nap, worked a night shift, and then I had to stay during the day for that meeting. And then the plan was to go home. But I remember just feeling so just fatigued and emotional for no reason. I was crying at one point, and I don't know, I recognized this is not my normal. I don't know why I'm crying. It's because I'm pushing myself physically to this point where I'm exhausted. I need to do something different. So I would say that's probably the moment I really realized that this is chronic. This is really becoming an issue. I would say that was my burnout moment for sure. And then it took another, 6 months before I was ready to try and start transitioning out. But I don't know, that's probably the over bird's eye view of what occurred. And then in the meantime, it was my experience of burnout, but then I also had a huge turnover of staff on my night shift, a little bit on day shift, but the night shift really struggled. There was a lot of nurses that went to find different jobs. So then again, as the manager, you feel responsible for that. And so I worked hard to get that staff replaced before I left too. And I don't know, that's kind of what all happened.
Yeah, I can relate because it's hard to describe it because it's years of trying, and you're trying to describe it in a few minutes. So I know what it's like because it's not something that happens overnight. And what you said, where you just had a moment of exhaustion, it's the thing is with burnout is, and you could attest to this, I'm sure, it's you're not necessarily aware of it occurring as it gradually occurs, but you're aware of
sneaky.
Yes.
It just sneaks in. Oh yeah.
yeah, and you're just aware of that moment where you've had enough, where it's kind of like too late, or not too late, but it's like it could be too late. It's just like you have definitely gone through all these stages. It's kind of like layers and layers building up. So yeah, I I had my burnout moment, was in tears. I had two separate ones that were just remarkable because they were like in tears in the bathroom at work. So it's like, how do you get to that point? There's many factors, and it's like everyone's story is unique, because I can't even imagine how heavy it was for you to do that sort of machine and everything that went into that. And for me, it was like totally different, but it's like still we end up exhausted emotionally. We end up just completely, just kind of not broken, but just kind of like a little lost inside,
Yes.
So
just totally drained, and then you spend whatever days you do have off, you spend them trying to get some of that energy back, but you don't quite get there. You don't quite get that tank full, so then you go back and then it gets depleted again, and it's a vicious cycle if you can't like get on top of it.
Right. And I know you mentioned something about like lifestyle, and I can attest to that, because it's like, I remember being burnt out. It was kind of like a facade of trying to be happy during my time off, but it wasn't real. Can you relate to that?
Oh my gosh, absolutely. Like, I think the first year was probably, well, it was definitely hard, because I'm a brand new manager. I'm trying to figure all this out. The second year was slightly better, even amidst all the ECMO chaos of trying to get all the stuff established. One of the things I did that made a big difference was I switched, instead of commuting 40 minutes every day by personal vehicle, I chose to take a commuter van, and it forced me to leave at the same time every day. So I was like, I want to say it was I put in my 9-hour day. Majority of the time, there were days I'd still drive in if I knew I'd be late or if I had something going on, but taking the commuter van like saved my sanity, because it forced me to leave. I had no option but to say to my staff, like, I'm sorry, I have to go now. Like, and they were really good at telling me, like, hey, aren't you leaving soon? Like, they kind of caught on to it too, and they oh my gosh, I had the best nurses to work with. They really tried to protect me. They knew I was starting to get burnout. Like, they could tell. I had some really good people to work with, thankfully, and a really good leadership. It was just kind of a unfortunate circumstance, and again, many things I do differently, but that was one thing I'm so glad that I did do.
Right. I have a friend that does that. She is a physical therapist, and she does this similar concept, but it's a bus, but she has to get on it. Yeah. It's like I don't even understand. She drives somewhere and she parks and she leaves her car there, and then the bus picks her up and then takes her to the hospital. So it's like, yeah, when she has to go, she has to go. Mm-hmm.
That's perfect.
Yeah. Actually, for me, my therapeutic, well, now, but back then it was totally different. But my therapy is listening to podcasts during my drives to work.
Yeah. No, I love doing that.
Yeah, but back then I was trying to bury the fact that I was burned out, because I just felt like I felt like weak. I felt that way. I felt weak. And that, so I wanted to find happiness the way a lot of other people did, by happy hours and, kind of like complaining to each other about it. And it's like, I would go to sleep every night with so much anxiety, and I'm like, well, I'm doing the best, right? I was just like, that time is just, it's just so interesting.
I know, it's so crazy to kind of look back retrospectively and be able to recognize what you couldn't recognize it then, but now you're able to identify it. Yeah,
like you said, you mentioned something about like looking at something from like way up top, like from a bird's eye view, and it's like when you are burnt out, you don't necessarily like, and as you start to get burned out, like that process that you and I went through, you don't necessarily see it because you're so in it, but it takes that like bird's eye view to like, and that awareness to be like, whoa, like this is happening.
Right. You're in survival mode. You
yeah.
think about like trying to get big picture ideas of things. Like, I don't know. And even if you do, I don't think it's, hindsight's always 20/20. Like you're always able to tell looking back a little bit differently. Like, I don't know. That's my version of it anyway.
Yeah, exactly. And from what were some valuable lessons that you took from that whole experience?
Well, I mean, I think the biggest one is the first thing is just that I have to like take responsibility for my own well-being. There was a point where I was just kind of giving of my time, my energy, just everything I had, and whatever is on the other end will just kind of suck and take away and accept all that as long as you're willing to give it. I'm the only person who can control it and protect myself. So I had to learn that lesson the hard way of just, what are my limits? What are my boundaries? What am I willing to do and give on a daily basis to the world, I guess. And so I had to learn that. That was the biggest lesson. And that's like the number one thing I would tell, Anna 20 years ago or 10 years ago, the 20-year-old Anna, that's the first thing I would tell her is nobody's going to tell you when to stop. You have to do it yourself. And, you may think you're being nice and helpful and loyal, and all these things are great, but, there's a certain point when, you have to take control of it and realize, what's healthy for you. That's the biggest one, walking away.
Wow. Like you said that so beautifully, because in healthcare, we want to save everyone. Like we have like this savior syndrome. I don't know if that's the real term or if I just made that up, but like, like we, exactly what you said, like if we say no, or if we don't, like, if we say no at work, or not necessarily like physically saying no, but maybe in other ways, like then we're not perceived as a team player. We think that, okay, then, people are going to think we're not a team player, or that we're not loyal, or that we don't care. And it's like, it's actually about protecting your energy.
Yes, that is so true. It's hard, and you don't want to be looked on that way, but after a while you learn like what is and isn't worth it. Is the money worth it? Is the people looking on at you as being the helpful person worth it? And eventually it's not. It's you just have to protect yourself.
Yeah, you have to protect your energy. And I find that a lot of, okay, first of all, I want to ask you, this is kind of like I know what the answer is, but so did your recovery, or like did your healing happen quick or overnight, or was it like a gradual process?
Oh my gosh. Well, just as gradual as it sets in.
Yes.
I would say it's just as gradual to kind of improve, and I'd say it's still improving. I don't think it's necessarily gone. Well, I know it isn't. I'll get to that in a sec. So when I transitioned out of the nurse manager role and went back to the bedside, I went and did a travel nurse assignment for 3 months that was night shift. I'm definitely more of a day person, so nights wasn't incredibly helpful in trying to like regain my sanity. But I went to another travel job after that was day shift. I was feeling good. I'm about 2.5 years from that point when I left, and definitely ups and downs, but I feel like I feel more myself. I feel like I have energy to do things outside of work, enjoy hobbies like I used to, whereas before it was all just, again, survival mode. And it's improving, but even then, just the other day I was working in the ER, and there was a patient scenario happening that I could feel myself feeling emotional about, and kind of getting the tight chest and the tight throat, just like I want to cry. And I'm like, again, I'm a nurse. I handle these situations all the time, but something is off balance and I'm reacting to it in an emotional way. And not that emotions are bad, but you should, I don't know, I to be at a healthy point, I feel like I need to be able to balance that and be able to separate mentally a little bit, from work mode. And I don't know. So that to me, for me personally, that's a sign that I'm still recovering.
Yeah, I don't think any of it, well, I think that we're still young, and I think it's a process. Like, I was kind of like not real when I asked, did it happen overnight? Because I know it didn't, but it's like, I want people to understand that it's not like just as it happens gradually, the recovery is gradual. And I can say it has taken me years to realize like what I need from my employment and what I need to develop in myself. And it's a process, and it's like now, like looking back years from where you are years ago to where you are now, like do you feel like the way you handled that moment in the ER like is so much better now? Not that it's perfect, but that you're like so much more aware.
Oh, definitely aware. Absolutely. I mean, it's a good thing to be at that point, but I guess it's unfortunate that that's where I'm at. But I mean, I would say almost every healthcare provider is going to go through it at some point. I mean, burnout it affects at least for critical care nurses, they say 1 in 3 is going to go through it. So, or at least symptoms of it. So it's out there.
Yes. There are, I have a million stats about about it, and it's like they get blurry in my head because there's so many. Yes. which is sad. And I know what's just like random, I can think of like women, especially women with children, women between 25 and 35 are more susceptible to it. And I feel like it's our roles, maybe because I don't want to get into this, but it's like maybe because women have children and they're probably in these studies primary caregivers, so their perception of burnout was higher because they have to, manage all these roles. So anyway, that's why we are on a mission to educate people in healthcare, you and I. So I really love that we both like share this vision. So can you tell us more about the Burnout Book and what that's all about?
Oh yeah, I'd love to. So the Burnout Book is a website that I started in January just this year. I kind of had the dream for it maybe 6 months prior. Just after attending a nursing conference, I recognized that burnout is a huge topic. Like I said, it affects so many people, and I had my own personal experience with it, and I wanted to share that with people and be able to relate and make sure that people didn't feel alone in it. So that was kind of the start of it, the seed that was planted. So I started the website. I have a blog where I am interviewing nurses who have experienced burnout and sharing their stories, calling them my case studies. And then I'm just trying to promote through Instagram that resilient nurse lifestyle, trying to make sure people have, just the tools, the burnout tips, like all just the community, the different things that might be helpful in managing their mental health on a day-to-day basis.
Yeah, I love that. And I wrote for Anna and Anna wrote for me. So you can check out our blogs, our guest blog posts on each other's websites. Yes. So this is a little off topic, but I can't wait to ask you about it. And we'll get back to more about your site. And at the end, we'll share how people can find you and all that good stuff. But can you talk about minimalism, because you shared with me that you were a minimalist, and I've seen some pretty serious documentaries about it and how it affects people's quality of life and all this big movement. So can you talk about that?
Oh, I'd love to. Okay, so this started years ago when my husband approached me about the idea of us, like, would we ever be able to downsize and live in a tiny house? And initially I was like, why would we do that? We have a 3-bedroom, 2-bath, lovely house that is just fine. It has my kitchen and all my kitchen gadgets, because I love, one of my hobbies is being, a baker in the kitchen. I love making desserts and cakes and cookies and all sorts of stuff. So I just was like, why would we do that? So I would say it took him probably a year and a half, almost 2 years, to like really, I don't know, get that idea to a place where it was feasible. So I don't know, like it just slowly warmed up. I warmed up to it, and we would watch videos, like you said, there's documentaries and HGTV shows, and we would just look at that lifestyle. And so what we did is, we started getting rid of things, kind of purging out all the stuff we weren't using. We got rid of old wedding gifts and stuff in the garage that had been sitting in boxes for years, all the easy stuff. And then we went and stayed in a tiny house in Portland. We did one of the Airbnbs and rented the house for a couple nights. And we loved it. We fell in love with the feeling of how freeing it is to just not have stuff lying around or stuff to manage. And it's like that feeling you have when you go on vacation and you're staying in a hotel and you don't have to worry about all the extra home life stressors. It's like, that's like the closest feeling I can relate it to. And that's a good feeling. So after we had that experience, we were like, all right, gung-ho on this. We found a builder in our area in Idaho, Tiny Idahomes.
Oh my gosh.
Yeah, thank you. That's the company.
Oh.
And we had them, from the point where we started like the process of designing and creating and looking at what the house would be like, I want to say it was about 3 months later that they had it built, and we were moving into our tiny house, and we lived on some friends' property with RV hookups for water and sewer and electric, and we lived in it for a year straight, and then we've lived in it kind of intermittently in the last couple years. Just with all the traveling, it's been hard to find parking for it every place we've gone to, but that has just been like, Erica, you have no idea how amazing it's been to get rid of so many things. We sold all our furniture. We got rid of, just like everything. I mean, right now I'm sitting on a folding chair, and I have a folding table from Costco. Like, I don't know, we have 2 IKEA chairs in our living room and a rug, and that's it. Like, we just, and granted, whenever we do settle down in the next place and buy a house, we're ready to steer away from being so extreme in our minimalism. But having gone through it is amazing. When you can get rid of all that stuff, and even for nursing, when I was at the point where I could have like my 5 pairs of scrubs, 6 pairs of scrubs that I would rotate through and just wash them. Like, that's all you needed. And then when you're waking up every day and you don't have to think about what am I going to wear, because you only have 5 shirts and 3 pairs of jeans to wear anyway, like, it's just it simplifies everything and just frees you. I can't even tell you, like, until you try it, you don't even know.
Yeah, like, my husband jokes about that, but he's serious. Like, he really wants us to be minimalist.
When you start traveling, that'll be a great time to try it.
Yeah.
You're going to be living, so simple out of, just whatever you can pack in your luggage.
Yeah. I think, now we're purging a lot of things because we have to, because we're going to be moving. But yeah, I think this is a good transition into a more minimalist lifestyle.
Nice.
Yeah. It's just, this is like a me thing. This is an Erica thing. And this is just like, I know people, not necessarily in Florida, because you can't really buy, like, your money doesn't go very far here. But I know people in like in other parts of the country where like they have these huge homes, and for like people our age in South Florida, like it's rare to see someone that has a huge home because again everything costs so much. Right. But I like going to like Mike's friends' houses in Pennsylvania. I would think that it's like the parents' house, but no, it's like people that from our age, and it's their house, and it's massive. And then to me, it kind of gives me anxiety that you have a massive house with all these rooms that are just empty, and then you have to fill it with like a bunch of things. So I like I'm not like I think I'm in the middle. Like I don't know if I could be like, and I'm really open to it. My problem is the clothes. For sure. And I kind of feel like a prisoner to it, to be honest. I feel like it's the fashion industry really makes you feel inadequate if you don't keep up with the trends.
That is true.
And I feel like I have this thing in me. I don't know what it is. I have to explore that a little deeper, but it's like that clothes is and shopping is my vice. But anyway, like the minimalist lifestyle, like I feel clear. I feel energetic when like the space, when you really just have what you need, and it affects everything. Because imagine if you're going to work and you open your trunk and you put your bag in your trunk and it's full of shit, like versus going to work and opening your trunk and it's just clean. Like you don't, and like it's every time I used to open my trunk and be like, oh, like I have to clean out my trunk, and it's like this heaviness. But then if that turns into your life, that's clutter, like in your life,
Right. Oh, exactly.
Yeah.
It's not a bad, it's definitely a hard mindset to get to, especially the extreme end of it. It's not a bad thing to be in the middle. Like, I think, like you said, as long as you're at the point where you can appreciate the place, where you get rid of the clutter, you can be like a modified minimalist. That's a good way to do it.
Yeah, but I admire that you feel free, and it's like that lifestyle has really been serving you and your husband, and and if you feel extreme, that's, people might consider that extreme, but for you guys, that is what makes you the happiest. So yay.
Well, yeah, no, and I'd say the only downside is the fact that I think it kind of limits your hobbies. So like I said, if like before I loved baking, I did gift away a lot of my pans and little like cupcake accessories, like all the random stuff that I had collected over the years. I had friends and family take those, and I don't know. So now, like, you're kind of just limited in the physical hobbies of things you can do. So we've been spending our money on like experiences and travel, and my husband would love to get a shop and a garage and like woodworking tools and all this stuff, someday. So this has definitely been an enjoyable phase, and I think we've learned a lot from it, and we're going to take some of these tools and implement it in our lives permanently. But we are definitely going to get to a place where we'll own a house again and have a garage and like have normal furniture. So
I think my husband, he's in the other room. If he's not listening to this, he will when he edits this, but you are like his dream. He keeps joking, I can't wait until we have like one fork for each of us and one mug. I'm like, oh my God.
Wow.
He's serious.
Totally get along. Yeah.
I'm like, but I need 2 mugs, okay?
I know, because what if the other one's dirty? And, like,
exactly.
You don't necessarily feel like doing the dishes. Oh, I hear you.
Oh, yeah. This is cool. And I think a lot of people this movement is like catching, I guess in some places, not here, not in Miami. I mean, or at least I haven't seen it. But I know you talked about, you shared with me that you loved baking, and you talked about it here. So is that something that you would do if you weren't a nurse?
Oh, definitely. I haven't told you this, but when I became a nurse manager, right before that, I was feeling the need to do something different with my life, and contemplated, like, if I dropped to part-time hours at work, could I start a little baking business on the side? And I was legitimately looking up, what are the laws? in the state I was living in to do this. Like I was working in a bakery in high school. Like that was my thing that I did all 4 years during high school. I worked in a bakery at a ski resort, and like every summer vacation, every Christmas vacation, I was up there. Like we would mass produce all of the baked goods for this resort, and I loved it. It was so much fun to be like elbow deep in brownie and cookie batter every day. And I have like a million stories from that. But that, like, I don't know, like that was definitely when it all started. And so I've always kept baking as a side hobby, this side passion. And I've like had the chance to make wedding cakes for friends, and just, I don't know, like always, like whenever we're going out to someone's event, I'll bring dessert or bring something. And that's just like so enjoyable to me, to like, it's a creative thing. And I've always noticed that when I'm in the kitchen, it's a very, I don't know, relaxing thing for me too. Like if you've ever frosted a cake, it can be very meditative. I don't even know how to describe it, but like it's definitely a happy place for me. So yeah, if I wasn't a nurse, I'd definitely be in kitchen baking somewhere.
Wow, my husband loves you even more now. Yeah, I get you. So you're totally experiencing something called flow. And like I would say the name of the guy that coined the term, but his name is like the whole alphabet. It's really long. It's like shaka shaka shaka. It's like I can't, even if I have it in front of me. Yeah, like, but it's something we talk about a lot in occupational therapy, and it's a term I hear now. People that they okay. This is like a little, huh?
Tell me all about it.
This is like a little soapbox I'm getting on, but a lot of people like to steal the thunder from occupational therapy. And I came across this girl that is talking about flow without any background in psychology or occupational therapy. And I'm like, bitch, you don't know what you're talking about. Because I went to, like, I took exams on this. It's not, like, okay, I'm not like saying that anyone can't learn about it. It's a pretty like simple concept, but it's like people, and then like social workers and psychologists are starting to like talk about, oh, when people engage in an activity, it's therapeutic. I'm like, oh my God, that's occupational therapy. Like we have a whole field about occupations, and using occupations as a therapeutic means. OT soapbox. Okay, I'm gonna get off it.
No, you're exactly right though, and you definitely should get back on your box and like, because it's a legitimate thing. Like, yeah.
So you're using, like, when you bake, that you get into this flow state, and it's just the right challenge. We call it the just right challenge, and you're not bored. You're not anxious. You're like at this optimal state of arousal, and you described it as meditative. And that's something that, like, I'm sure, have you ever baked when you had maybe a bad day, or when you were stressed in it?
Yes.
And yeah,
I have a good story for that too.
What is it?
Well, okay, so the very first, I'm working with open heart patients. The very first time we had an open heart chest emergency where the patient, became unresponsive, we do CPR. And if you're doing CPR on a patient that's had their sternum cut open, it can be really dangerous because that bone is, sharp and has sharp edges, and there's wires holding it in place. Anyway, so the safest thing to do is to get the chest open and figure out like what's going on and fix it. And anyway, so the very first time we had a patient in their room have an emergency like that, and we had to like open up the chest at the bedside, and we're trained on this. It's like, we're ready for it if it happens. But the first time it happened to me, I went home that day and made like a huge batch of chocolate chip cookies because like I was so amped from the event of the day. I needed something to do to calm me down before I could fall asleep that night, and that's what I did. I made cookies.
Yeah, that's perfect.
My coworkers loved it the next day, so.
Yeah, that's perfect. And it's like another soapbox really quick, but and I think this relates to you and relates to any entrepreneurs in healthcare. Like, and I'm going to just talk about OT specifically, but again, I think this could be relatable. Like, I went to school learning that my, occupations are therapeutic, and we can use occupations with all ages, all conditions, physical, mental, developmental, and we graduate school, and 99% of people, I just made that up, but 99% of people, we go for the very traditional role, right? So we're working with in a hospital, or we're working with people that have had strokes or orthopedics or children, like, and all these, OTs, we serve like so many roles, like nurses, like there's so many roles, so many settings you can work in, but no one really talks about, especially like an OT, like how you could do something non-clinical. Like that's why I'm so interested. Like that's why I'm so interested in what I'm doing, because there's a branch of OT called or a part you can get involved in called ergonomics, and we like have you heard of that?
I know the word, but not in an OT setting. So yeah, keep going.
It's like OTs occupations are anything that occupy your time. So work occupies a lot of people's time, and ergonomics is like when you assess the mechanics of someone's work environment, like if everything is set optimally, like if you're working in a factory, like you want to avoid like common injuries at work, or if you're working like those type of things. And OTs,
I've heard it used in that reference, safe body mechanics, that kind of stuff.
So OTs and PTs can do it. I don't know, there might be another profession that does it, I'm not quite sure, but I learned about it in school, and it's like these really cool niches of OT, and I'm sure there's so many cool niches of nursing, and it's like, okay, I want to create an opportunity for myself to help people with their mental health, and it kind of like ergonomics, but for the team and for the organization of like oh my God, I lost my train of thought because I'm making like all these hand gestures. I'm like, really? like basically ergonomics, but for like a workplace culture to prevent burnout type of thing. Like, what does that make sense?
Yes. Well, and what I love about that is you're approaching it from a team aspect, because like I can do great things with my personal life to optimize my mental health and like prevent burnout. But unless you get a healthy work environment and the people around you involved, whatever issues like are attributing to that burnout, they're not gonna go away. And the ideal goal would be to get to a point where you're not necessarily needing that weekend to recover. It's like you need to be at a place where you're not getting burnout. And if you approach it from that team aspect, like I freaking love that.
Yeah, I really don't know how we got to, I'm glad we're talking about this. I'm like, how did we get here?
When you edit it and look through it, I'm sure we'll figure it out. I have no idea.
But yeah, it's true. Like, it's, that's the beauty of healthcare. It's like you can, like, you're doing something so amazing. And being an educator in healthcare, it's like there's so many opportunities. So I'm so excited for you. I'm excited for both of our paths and our journeys, and we're just like getting started.
I know, like, yeah, to watch the growth that's coming from Joy Energy Time, I'm excited to see what happens, like, how it'll evolve. Like, it's already, from the part, like, since I started following you and kind of watching your journey, like, it's already grown so much, I feel like, and I don't know, like, between the podcast and all the tools that you're providing, it's needed. There is such an audience for it. Like, thank you for what you guys are doing.
Oh, no, thank you. That was really nice. Thank you so much. I appreciate that. I appreciate this because, it's everything we do is grassroots, like, and it's, yeah, like, yeah, it's just so cool. Like, we wouldn't be doing this if we didn't enjoy it and if we didn't want to help people.
Right. Yeah. If we didn't. So in a way, our personal experiences with burnout, we can thank, those for getting us to this point. You know, they were awful to go through, but they obviously made us to, stronger people and able to help others. So it's working out.
Yeah. It's like a blessing in disguise. Like, totally. I feel like we had to go through all these different steps and everyone does. Like, we have to go, like, we all face these obstacles, and we're like looking back. It's like, wow, like that. If it wasn't for that, like, we wouldn't have been this strong.
Right? Exactly.
Yeah. So I have one more question, and plus my signature question, and then we'll talk about where people can find you. So where do you see yourself in the next 5 years or even the next 10 years?
Again, I'm a reflective person. I try and at least, I don't know, every year, if not more, try and like figure out where I'm at, what I like about where I'm at, what I want to do differently. I guess you could call them New Year's resolutions. We all do. I in the next 5 years, what I would love, like what would my dream be? I would love to get to a point where I'm, either getting my master's degree or have gotten it. I'd love to transition to some kind of role within nurse education, whether it's in a hospital setting or whether it's in a institution, a teaching facility. I'm not sure what that'll look like, but whatever I'm doing, I want it to be helping nurses, helping with training, education, something in that realm would be amazing. That's definitely something I've noticed that I see as like the highlight of my day, when I'm able to help somebody learn something new and figure something out. So I could see myself getting to that point. In the meantime, I'm going to keep working at the bedside. I may try on a new challenge and try out maybe a procedural area. Maybe cath lab is an area that I have considered going to. Just being a nurse over in that area could be really interesting, I think. So that's kind of like the 5-year plan. And then 10 years, like and I guess with the 5 to 10 year, I would love to just continue growing the blog and continue connecting with nurses on Instagram and social media, because who knows if Instagram will still be around in 10 years, but just finding ways to, just make sure nurses definitely don't feel alone whenever they're going through these burnout emotions. Make sure that they feel like there's a community there, and that they have maybe some tools of how they can handle it and deal with it, and help them. Just like my thing is to help them keep that spark for nursing, that they don't get completely burnt out and want to switch careers completely. And I don't think that's the case majority of the time. I think most people find something within the whole realm of nursing that works for them. And I would just love to make sure that people do, find that thing for them that fulfills them in a healthy way, mentally, physically, emotionally. So, we'll see. I don't know. That's kind of what I'm thinking about so far.
Awesome. I love that. Like that, helping people keep that spark. That's amazing. So, okay. Oh my God. Before I ask my last question, I just want to tell everyone listening that if you follow Anna, you're going to see her cute corgi. How do you say it? Corgi or corgi? Like, how do you say it?
Corgi.
Okay. So someone corrected me because I say corgi, and I'm like, what? It's been corgi and I've been saying it wrong the whole time. Walter.
Yes, Walter. He is a Pembroke Welsh Corgi, and he is a year old now.
Oh my God. I live to see Walter.
Good, because I post him all the time.
Yeah.
I am that person. It's bad.
No, but when you do the yoga, the sped up yoga with Walter.
Oh,
that's good.
Our little time lapse yoga. It's been 2 weeks since I've done it, Erica. We have been traveling so much. Tomorrow I fully plan on getting a little yoga session in.
Oh, a little Walter.
He's fun. He's a distraction more than anything, but I love it.
Oh yeah. I tell Mike all the time, we need to get one. He's like, not with travel. Like, we'll get one. We'll or a pet. Like I just want a cat. Like I want something. But okay, so where can people find you and connect with you?
So most of the time I'm very active on Instagram, as long as it's not one of my 12-hour shift days. Mm-hmm. So Instagram, you can find me at the Burnout Book, and there's a period between each word. And then I'm also at Anna the Nurse on Instagram. There's those two avenues. There's Facebook, Anna the Nurse. And then I have my website, theburnoutbook.com. And there's a blog there, as well as, just resources and a few other things. It's definitely a work in progress. I'm building it as we go. But, still working full time. It's a side project for sure, but it's obviously something I'm passionate about, so...
Mm-hmm. I know. I'm right there with you. Awesome. So, final question. What makes you your most lit up self?
Ooh, I love that question. When my most lit up self would be when I'm going to go back to like kind of what you were saying about finding that flow. When you have that balance between it, you've got your kind of your social life, your work life, spiritual, physical, emotional. There's all these different components. I'm most lit up when I'm able to find a way to meet the needs in each of those worlds. There's never a time when it's going to be fully balanced. Like that's kind of unrealistic, but
yes,
when I'm able to at least meet the needs of most of them, and it's all about like Maslow's hierarchy of needs. Like when I'm finding, that I'm feeling good, I'm feeling healthy, I'm feeling like I've got my social needs met, and I've got my relationships are solid, and just kind of building up from there. And I don't know, just ultimately, it's about the people, I think, in my life when I'm able to interact and feel appreciated, but also show appreciation. Those are the times I feel like the happiest, the most lit up.
Yes. I just want to add to that when you mentioned the hierarchy, Maslow's hierarchy of needs, that's interesting that you said that and how you ended with that, because social belonging and that social component is now being considered, from what I've read, I don't know if it's official, but it's like one of the core needs. And it's like, just because we all need to feel connected and loved and love others. So that's just like perfect.
Yeah, I would agree with that.
Yay. Well, thank you so much, Anna. It was a pleasure to have you. We will definitely connect again. Hopefully we can meet each other soon.
Yes, let's make it happen.
Yeah. So, yay. Thank you so much.
You're welcome. Oh, thanks for having me, Erica. I love talking to you.
Thanks for listening. If you want more, be sure to subscribe to this podcast. Also, share this episode with your friends, and I would be so grateful. If you feel inspired, leave a review on iTunes with an honest comment and/or what you'd like to hear more of, so you can help me out on my journey in delivering meaningful content. Thanks, mis amores.